Chapter 12. Observation as Misinformation. Dr. Ryan Cole, pathologist. Dr. Ryan Cole, MD, is a pathologist and physician based in Boise, Idaho. He received his medical degree from the Medical College of Virginia at Virginia Commonwealth University and further specialty at the Mayo Clinic in Rochester, Minnesota, also at the Ackerman Academy of Dermatopathology in conjunction with the Columbia School of Medicine in New York City. He is a board-certified anatomic and clinical pathologist with a subspecialty training and 20 years' experience in dermatopathology and particular interest in molecular diagnostics. Dr. Cole is licensed in states from coast to coast. The following chapter is being read on behalf of the author by Aidan Whitehock.
When COVID hit, I noticed that the guidelines coming out of the CDC and NIH did not seem consistent with my knowledge of viruses on many levels. Social distancing and recommendations to stay indoors did not make sense. School closures did not make sense. Masking requirements and plexiglass dividers did not make sense. The types of businesses allowed to remain open and those required to close did not make sense. The lack of basic public health guidelines for overall healthy living and disease prevention did not make sense. Most of all, the treatments of patients in the hospitals did not make sense. At no time in the history of medicine has the general rule been to tell patients, go home until your lips turn blue and then we will see what we can do. Or that we don't have any treatment, just wait for the vaccine. My journey to involvement in the medical freedom movement began long before we knew anything about COVID. As a board-certified pathologist, I have spent my career making observations about patterns and reporting my findings. My job is to tell the truth about what I see, and I have practiced medicine by the maxim that the cells don't lie. I never could have anticipated the ways that sharing these observations would be twisted and construed as mis, dis, and mal information by scientific authorities, government agencies, and numerous media outlets. Pattern observation seems to be a natural gift for me, which I developed through many facets of life, playing the trumpet in orchestra and band during high school and college, learning to speak Spanish fluently, studying aeronautical engineering at the U.S. Air Force Academy, recognizing bird songs and flight patterns as an amateur ornithologist, and classifying tree species for woodworking. When I was in medical school, this gift was especially evident in our required histology courses. My professors and fellow students quickly perceived that I had a knack for cell pattern recognition through the microscope. In my fourth year of medical school, I completed rotations in family medicine, dermapathology, skin pathology, and forensic pathology, as I was trying to decide what kind of doctor I wanted to be when I grew up. I was drawn to the personal interaction and continuity of care of rural family medicine, and at the same time knew I had a gift for pathology that was not common amongst my colleagues. Both specialties utilized my observational skills, though in different ways. A rotation with the pathology department at the Mayo Clinic in Rochester, Minnesota, helped finalize my decision, and I applied to several pathology residency programs, ultimately matching with the Mayo program. There I spent 4 years in general pathology training, and 1 additional year as the Chief Fellow of the Surgical Pathology Fellowship. The Mayo Clinic is unique in both the volume and complexity of cases that come through the pathology department, and my experience there honed my pattern recognition skills for all different types of cancers and disease conditions. In addition to my required residency and fellowship hours, I took on 30-plus hours per week moonlighting at a family practice clinic and several local emergency departments to deepen my clinical skills. Treating patients in these environments requires thorough observation, rapid assessment, and definitive diagnosis and treatment. Frequently, patients would ask if I could be their regular doctor, and the nursing staff was always reassured to see my name on the schedule, knowing they could trust me to provide excellent care to every patient that walked through the door. Upon completion of my fellowship at Mayo, I was selected as a fellow at the prestigious Ackerman Academy of Dermatopathology in New York City. The academy was directed by the late Dr. A. Bernard Ackerman, then considered the eminent expert in the field of dermapathology. I served as Dr. Ackerman's Chief Fellow for the year, where my skills of observation and pattern recognition were applied to the diagnosis of skin disease. Dr. Ackerman was an excellent teacher, and during my time at his microscope, I was steeped in the philosophy of diagnostic medicine, in addition to learning how to differentiate skin conditions. Part of our required training was also in the dermatology clinics, allowing me to correlate clinical diagnoses and treatment with microscopic diagnoses. One of the main tenets that Dr. Ackerman reinforced was the importance of providing the clinician with a clear and concise. To listen to the remainder of this essay and the 33 other essays, please visit Amazon to receive your copy in print, ebook, or audio. Thank you.